Brewitt. She is the Executive Director of the Council for Children and Adolescents with Chronic Health Conditions. She joins us from Concord this morning. Governor John Lynch has declared this week Chronic Disease Awareness Week in New Hampshire. Governor asking all New Hampshire citizens to observe the week by promoting healthy lifestyle changes and encouraging people to become educated on chronic disease prevention, awareness, and management. And we're hearing the very compelling story of Denise's son, Ryan, who suffers from a very rare chronic health condition as well. But Ryan is also the child ambassador for the state of New Hampshire for the Children's Miracle Network, too. He's had some pretty good things to be attending lately, correct?
Yes, actually.
Kind of fun for him in a way.
Yeah, Ryan is our little celebrity. I think that he's very close with Governor Lynch and did represent the state of New Hampshire last year for 2007 as the ambassador for the state for the Children's Miracle Network. And so we went to Washington and went to Capitol Hill and spoke to our senators and our representatives down there to let them know that, there are lots of kids who are dealing with these medical conditions and having these issues, but they are able to succeed if they are provided with the screening and the medication and the treatment that they need and the community support that those are provided. These kids can succeed. And we also went to the White House, and so Ryan was able to spend some time with President Bush, and then off to Disney World, which was probably better for Ryan than the White House.
Sometimes that's better for everybody.
Exactly.
You'd rather go to the White House or Disney World? Well, let me think about it for a second. Okay, Disney World.
Exactly. So, I mean...
Sounds like a great kid, really.
He really is. I mean, he has taught many people in his life a lot.
That's cool. That's very cool. I don't mean to put you on the spot, but Denise, did you say initially that we are seeing an increase in the numbers of adults and children with chronic disease, or just in children?
Really, actually, in both. I mean, both are on the rise. I mean, it's something that we as an entire community really, I mean, obviously, like I said, I mean, the population that I deal with is children, but in fact, I mean, the chronic disease is on the rise for everyone within our state. And so it does need to become a priority. It needs to be, why is this happening? What are we doing as a society that people are sicker today? And that was one of the issues that we're definitely trying to get, our decision makers in policy to address this. That
Right.
this should be, this should be in a top agenda item of why chronic disease is becoming, the number one leading cause of our health care costs, why, people are just becoming so sick.
Is there anything our government or our state legislature or even our federal government can do to help fight this, or is the government there just to sort of create this awareness by making this type of proclamation?
Well, I mean, there's different. I'm very interested to see what, of course, Senator McCain has some ideas of what he would like to do. I had spoken briefly with him at a town hall meeting, and one of the things that he had talked about was he wanted to provide an incentive program for physicians to keep their patients healthy. I mean, so there's different ideas out there, and I think that to just, to keep, making sure that it stays on their radar and that they keep plugging at it to say, what can we do to reduce these numbers? So it isn't just becoming awareness, becoming more aware, and letting businesses know that they should support this idea of having their employees be more healthy and the importance of diet and exercise and nutrition, and allowing families that if they do have a child who has a chronic health condition, a cancer diagnosis, that you are going to have a much better employee if you allow that employee to take care of their family and tend to that sick child and take that time off if they need the time off to, be in Boston for a bone marrow transplant. I can assure you from my own personal experience that a family who has an employer who is responsive to that family in need is definitely a much better employee once their families through that crisis.
No, I agree totally with you. Do you sense that New Hampshire as a state is sort of maybe more open to this now? And I don't want to use the word user-friendly, but I can't think of a word at this time, but sort of more open to making these type of changes or expressing these changes to the citizens and the residents of the state?
I think so. I think we're getting there. I really do. I mean, I think that New Hampshire, does want to take not only, take care of their, their children especially, but I mean, I think, that as a whole, New Hampshire citizens do not want anyone who is in need to go unaided. And there are many people out there who need our help.
All right, Denise, we appreciate your comments and your expertise on this. We want to wish you the best, of course, you and your son Ryan and the rest of your family. Send all good thoughts out there and hope things work out for you. But thank you for sharing this information because this is very, very valuable information as the governor has declared this week Chronic Disease Awareness Week in New Hampshire. And thanks to Denise Brewitt, the Executive Director of the Council for Children and Adolescents with Chronic Health Conditions. And give all our best to your son Ryan as well.
I will. Thank you so much.
Thanks, Denise. Be well.
Bye-bye.
Thank you very much. 11:36 on WTSN.